Medfit Rehab founder Joanne James is a medical exercise specialist. Medfit Rehab, restoring strength and movement, making a difference in people's lives. 647-259-5481. Columbus Center, Athletic Department, Dufferin and Lawrence, medfitrehab.com. If you've been diagnosed with a chronic ailment, diabetes, osteoporosis, cardiovascular cancer, Joanne James, medical exercise specialist for over 25 years, is your answer. Joanne and her hands-on team of professionals will design a customized medically based exercise program for you. Medfit Rehab provides the best in post-rehab functional conditioning programs. Medfit Rehab, Columbus Center, Athletic Department, Dufferin and Lawrence, 647-259-5841, medfitrehab.com. Hi, Joanne. How are you this morning?
I'm great, Zelda. How are you?
Not too bad, not too bad. I wish
Fantastic.
It was a little warmer, but it's fine.
Well,
okay.
We don't have much choice in the
Not
matter.
at this moment. No, we don't. Absolutely. Okay, thyroid disease. There are different kinds of thyroid problems, but will exercise help?
Yes. Based on the research I've done, exercise will help. Couple of things, though. The most common ones that I think that people experience is hypothyroidism and hyperthyroidism. And the thyroid is a gland that's located in the lower part of the neck. So if people are wondering where that is, that's where it is. And it secretes a hormone called thyroxine. And there's another hormone that it secretes, but I couldn't pronounce the word. So I'm going to stick with thyroxine T4.
Okay.
It's a different language altogether. And basically, when you either have hypothyroidism, generally it results in weight gain, depression, muscle loss, low energy. With hyperthyroidism, a lot of sleeplessness comes along with that. Again, low energy levels. And those are sort of the standard. But there are a lot of other symptoms, but that's the ones that you see that are most commonly referred to.
Okay, but there's a lot of different kinds of thyroid problems.
Exactly.
And are they all sort of noticeable to an individual? I mean, you could live a while without having noticed that there is something. I mean, what are some of the symptoms of a thyroid problem?
Well, just some of the things that I had mentioned. Sometimes people, like one person I was talking to, and I looked at her one day and I said, are you okay? She was shivering. Actually, she was shaking, and it was like shivering. And that was one of the symptoms that she had. Her eyes were bulging a little bit. Again, she was gaining weight. Her energy level was quite low. Fatigue is pretty common. Sleeplessness for hyperthyroid. Some of the things I mentioned, those are some of the things. And then, of course, there's symptoms that people don't even notice. But what's probably most important is, regardless, if you feel some sort of a swelling at your neck, then you need to go in and have it checked right away. Sometimes it could be a swollen gland because you're getting a cold, but other times if you feel a lump there, you need to go and get that checked out. So like anything else, it doesn't always present the way you think it's going to present, but it's something that if it's your thyroid, you must get it checked out.
So what type of exercise would be beneficial for any of these problems, and would you need a doctor to agree to, yes, in fact, we do exercise would be,
Absolutely, Zelda. The thyroid is a really important gland, and it has such a major impact on how we feel from day to day, how we perform, that it has to be diagnosed by a doctor, and then you've got to really be carefully monitored by that doctor. They'll give you medication, and that's a whole new different ballgame because the medication makes people gain weight, but sometimes they over prescribe the medication, sometimes they under prescribe it, so there's a whole process of making sure that they get the right dosage for you. And then once that's been done, then you can look at exercise as complementing that, because the exercise will help to control or help to increase your metabolism if it's slowed down, increase your lean muscle mass. Interestingly enough, you lose lean muscle mass with thyroid issues. It'll increase your calorie burning, hopefully your energy level, boost your mood. Those are some of the benefits that you can get from exercising when you have a thyroid issue. And you were asking about the type of exercise. Well, two things. One, aerobic is probably most recommended, but number two, it cannot be done at a high intensity. You cannot go out there and knock yourself out and try to get as much of a workout as you can.
I would assume that would be the case, right?
Yeah, you got to moderate as much as you can. And we work with people with thyroid issues because we help to dictate and figure out where the moderation is for them. Some people still go beyond what they can do. Others, well, they don't work hard enough. They don't have the right intensity for that exercise to make a difference.
That's the reason why Medfit Rehab will be of great help to you. Thank you, Joanne. We'll look forward to talking with you again tomorrow. Have a wonderful day.
You too. Take care.
Take care. Bye. Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne James, 647-259-5481, Columbus Center, Athletic Department, Dufferin and Lawrence, medfitrehab.com.